All right, so let's talk about some heat and cold. Of course, we've been seeing a lot of cold here the last few days, right? So objectives listed here, you can take yourself through those, but basically we're going to be talking about the basic science about heat transfer, and we'll talk about the different things that are used in PT clinics, and important things for all the things that we'll be talking about this semester will be contraindications. That'll be something to definitely make sure you memorize those lists of things, and then through the lab, we'll figure out how to choose and use the most appropriate thermal agent to get the effect you want. Okay, so what we're going to be talking about then over this deck of slides: principles of thermal energy. We'll talk cold, we'll talk heat, and then on another day we will do the lab and experience these things. All right, so thermotherapy. So basically that's just the therapeutic use of heat, and cryotherapy terminology is the therapeutic use of cold. You'll hear different things: cryokinetics, cryotherapy, cold, ice packs, things like that. But probably the more technical term is cryotherapy, and we did use that for your search term for Feedly. So what is heat then? So heat is energy that's produced by the movement of atoms and molecules. So as atoms have energy put into them, they start to move faster, and that starts to produce heat. And so when we have cold, that's the absence of those moving molecules. And so as we look at the different types of heat transfer, you'll get a little better idea, I think, of exactly what we're talking about here with heat. So we can define our different types of modalities as superficial and deep. And really all we're talking about today is going to be the superficial sorts of thermal therapies. Hot pack, whirlpool, paraffin. Next week we'll be doing ultrasound, therapeutic ultrasound. And that's more of a deep heat modality. And by superficial, I'm talking about, like about a ½ inch or so. So, less than a centimeter is what's listed here on the slide, 2.54 centimeters in an inch. So it doesn't go very deep. Okay, so when we start talking about these different types of things that we're using, and as I mentioned, ultrasound, it'll get us down to 5 centimeters, and if you ever have access to what's called a shortwave diathermy unit, that goes even deeper. Those seem to be making a little bit of a comeback. All right, so just a little recall here on the interdot transfer coefficients. I'm sure you remember this from your physics classes. If you don't, you probably spent a little time looking at that. And just remember the NCQD to substrate transfer model and the different things with capping layer. Just kidding. Okay, I don't know what this slides means. I pulled this straight off the internet. So anyway, doesn't mean anything. But hey, here's what we're going to talk about. We're going to talk about principles of thermal energy. All right, so we're going to talk about modes of energy transfer. We're going to talk about a thing called specific heat, and we're going to talk about rate. And those are probably the important things that we need to know when we're talking about thermodynamics. There we go. Got a little tongue-tied there. Okay, so modes of heat transfer. Okay, so we're going to be talking about conduction, convection, and radiation. All right. And then your book talks about one called conversion. Sometimes in this particular text, it comes up with some things, or whoever wrote the chapter. You won't find this in an engineering textbook so much as conversion, but that's what she calls conversion. That's when you take one mechanism and create heat. So she'll call conversion, ultrasound, which puts energy into molecules, makes them vibrate faster, and causes heat. And so she calls that conversion. So as a method of heat transfer, I'm not sure I agree with that terminology, but anyway, that's what's in your book. So because it's not really a true transfer mechanism. Okay, so the most basic of heat transfer mechanisms and the most efficient is conduction. Okay, and as depicted in the diagram, you heat up one end of a metal bar, and we kind of probably intuitively know that heat's going to move through that bar and get hot or hotter at the other end, just like a handle on a cast iron pot on the stove, or on a cooking surface. So that's heat transfer by direct contact. So what do we need for that to occur? You got to have contact. That would be one. And the other big thing is you have to have a temperature gradient. Okay, so a difference in the temperature. So a delta T, a T1 and T2. So and heat's going to flow, or that temperature gradient is going to go from a high temperature to the lower temperature. Okay, so convection, and so I've depicted here in the diagrams, what's commonly used in our clinics, or maybe not so common anymore, but our whirlpool baths. Okay, so that's a form of convection as we circulate the water through the tank. And another probably common example is a heater, especially the radiator type heater, where we're causing the air to flow, heat rising, and then as it cools off, it drops and comes back down to the floor and heats back up and circulates. So that's what we're talking about when we say convection. Okay, so in there, the key word there is circulating medium. So we have to have that medium moving and circulating in order to have that type of heating mechanism. And then the third one is radiation, and that's direct transfer of energy without any medium in between. Okay, so good example there is the energy that we get from the sun. Okay, so coming through space with no intervening medium. All right, so we experience this as I'm showing there with the heat from a fire, but examples in the clinic are going to be an infrared lamp. If you see those in clinics, used to be in use. It's probably nothing you'll see. I have never seen one in a PT clinic. I have seen them in chiropractic clinics. So I think a lot of chiropractors are still using them to do some superficial heating prior to manipulation. But personally, I've not seen one in a PT clinic. Okay, and so when we do talk about using some sort of lamp, though, and it's the heat that you get from it is a function of how intense that lamp is, the size of it, the area that it's radiating on, the distance from what you're heating, so the distance from the skin, and the angle. All right, so and I think the reason why some of this is still covered because they still put board questions on this, even though it's something that really not being used. But probably the important thing here to get out of this more than anything else is one, it's a mechanism of heat transfer, so you recognize what that is. That there's no intervening medium. But then the other thing are the functions here. So and the questions that I can recall that are typically asked are questions that relate to the angle. So if it's directly in line, if the source is directly in line, or let's call it overhead, you get more energy. Okay, if there's an angle of incidence, so if it's angled away, you get less energy. Okay, if it's closer, you get more energy. If it's farther away, you get less. So probably a little bit intuitive, but those are the only sorts of questions that I've seen kind of put together with radiation. So just put a star on it. Not something you're going to see too much of, but again, it might be something that you do see on your boards. Okay, so another thing that mechanism we use in clinic is what we get from evaporation. And what you're seeing demonstrated in the picture there is a little thing called spray and stretch. We'll do that in our lab. And what's happening there when we're spraying is we're getting the evaporative effect. And when that happens, when we have evaporation taking place, we have a phase change. Okay, so a phase change is something moving from a liquid to a gas, or from a liquid to a solid, things like that. And so when that happens, when that phase change takes place, there's a pretty good energy transfer taking place. So in the case with evaporation, we're spraying something on, it's evaporating, so liquid becoming a gas, and we have a pretty big energy transfer that takes place when that happens. Okay, and so probably the only way that we're actually utilizing this in clinic is through a coolant sort of a spray. We'll talk more in detail as we go on here. And then, of course, the just common real world example is when we sweat. And so we sweat, we're changing liquid to a gas, and we get a cooling effect from that. Okay, so then a few principles of thermodynamics or thermal energy. And the first one to be familiar with here is just what's called the specific heat. And as it says there, it's the amount of heat required to raise the temperature of a substance 1 degree centigrade or Celsius. And that's also known as a calorie. Now, that's not the same kind of calorie that when we're talking food energy, that's actually a kilocalorie, but for whatever reason, we don't call it a kilocalorie. So it's 1,000 of when we say calories right here. So anyway, but this is the specific heat. And so really what it is, it's a measure of how much energy something can store or also release as well. So water has a fairly high specific heat of 4.19 joules per gram degree centigrade. Air is a little bit lower, or quite a bit lower, okay, at 1.01. And like I said before, the specific heat of water is called the calorie, so we get a single calorie, and everything else is kind of, it's kind of like the baseline for that. Okay, so what? Why is this important? Okay, so what this is giving us is some idea or some sense of, like I said, how much energy something can store. So one of the thermal modalities that we're going to look at is using paraffin, so using wax. All right, so that wax is at a pretty high temperature, but when we put our hand in it, it feels hot, but it doesn't burn us. Okay, why is that? That's because wax has a low specific heat, so it doesn't contain a lot of heat energy, so we don't have a problem with getting burned with that wax. Okay, so water, on the other hand, we get water up to a high temperature, and we cause severe burns with something. So there is a lot of energy contained in that heated water because it takes a lot of energy to heat it. Okay, so just looking at those relative specific heats, that's why that's kind of an important concept to have some idea about. All right, so related to that then is our rate of heat transfer. All right, so as we kind of intuitively know, again, when we talk about metals typically are something that have a pretty high thermal conductivity. We put a piece of metal in a fire or fireplace, and we pretty much know that that's gonna get hot and conduct that heat energy. And the chart over here is kind of showing us some relative thermal conductivity rates. Okay, and thermal conductivity is defined by the equation that's there in the first bullet, which is the area times the thermal conductivity times the temperature, and that's actually the delta temperature, so the temperature difference. But we can see air has a very low thermal conductivity. So how do we use that principle? All right, so think about any kind of insulating, the jackets that you're wearing right now here in the winter months to try and stay warm. So we have different types of insulating materials. Well, it's not really the insulating material so much that's giving us the insulating effect. It's the air that's being trapped by that. And so one of the best insulators that is used is down. Okay, and why is down used? Because it traps a lot of air in a lot of air pockets. The down by itself isn't what's giving us the insulating factor. So typically, what we're trying to do is have some way that we can trap some air, because air has that very, very low thermal conductivity, and give us that insulating effect. Okay, so rate then of thermal transfer is a function of the thermal conductivity. So looking at what kind of material we're talking about here, how much surface area is involved. So if we have more area, we've got a bigger highway then to have that that heat transfer. So if we're looking at our equation, area and that thermal conductivity are kind of direct measures. And the temperature gradient, okay, so the T part right here, the temperature gradient. Now, actually in this equation, it's actually a delta T over a dx, okay, so we talk about differential equations, but we can see the big thing to know here is that, when we really want to talk about this is just a thickness, so x1 minus x2, just the thickness of whatever material we're transferring through. And so since that's on the bottom of the equation, as that gets bigger, the rate goes down, right? So that's just a simple way to look and see that when we're going through something thicker, let's say adipose tissue, that the rate slows down. All right, so that's something that does decrease the rate of heat transfer. All right, so the things to keep in mind then with this is the greater the temperature difference, the greater the amount of heat transfer. Materials with high conductivity transfer energy faster than those with low conductivity, so metals. The larger the area, the greater amount of heat transfer, and the rate of transfer decreases as we go further and further in depth. And of course, we're talking about bodies. Okay, so let's talk thermotherapy, therapeutic use of heat and cold. Okay, so first with heat, we're going to talk about uses, effects, contras, adverse effects, and application, and a little bit on documentation. So uses of superficial heat. Okay, so traditionally, and I'm sure you're going to hear this as you go into your clinics, we're putting a hot pack on someone. What are we doing here? We're increasing blood flow, increasing the rate of nutrients to and the metabolites away. Well, yeah, sort of. Okay, but if that's the case, why don't we just have someone exercise? Why don't I have them pump that muscle? Okay, you're going to have a huge increase in flow rate to a much higher rate than you would if you're just putting on some superficial heat. So, it's kind of probably a nice thing to tell Mrs. Smith when you're putting a hot pack on her, but not quite physiologically true. So, the better reasons are the effects that we're going to get out of it. It's going to make someone a little more relaxed. Okay, give us some pain relief. So give us some relief from general soreness. And then, we're getting ready to stretch that shoulder or hamstring. We're able to facilitate our stretching a bit. And then, of course, we can target that blood flow increase. So if there's some small area that you want to target and not get blood flowing in all the other areas, the exercise example, well, we can target that a little bit by putting some heat on it. So it's just a diagram from your book showing the general effects of temperature. And as we can see here, the bottom line here is as we increase temperature, we're going to get down to where we get some vasodilation. So whether we're going this pathway where we're exciting cutaneous thermoreceptors, getting smooth muscle contraction over to vasodilation, or again, cutaneous thermoreceptors through the spinal cord dorsal root and get some decreased sympathetic response, so get vasodilation, or going down this side where we cause a little inflammation and get some increased vasodilators released, so we get vasodilation that way as well. So general effects then is we're able to increase cell metabolism, increase an inflammatory response, decrease pain, promote relaxation, like we said on the previous slide. We're able to decrease muscle spasm, reduce tissue stiffness, increase circulation. Okay, so the types of heat here for this lab, really all we're talking about are hot packs, paraffin, fluidotherapy. We'll see a sample of that here in just a minute, and whirlpool or contrast baths. If you need to get deeper than in that inch, really what we're talking about is going to ultrasound or shortwave diathermy. All right, so metabolically, what happens when we apply heat? We increase the metabolic rate, so we speed things up. So that'll bring up a contraindication, is that where you don't want increased metabolism happening, you probably don't want to be putting heat into that system. And we get about a 2 to 3 time increase for each 10 degrees that we increase the temperature, and 10 degrees C. Okay, keeping in mind that we're going to get soft tissue death occurring in the 113 or so range. So while heat and cold are our simplest modalities, there are probably more injuries with the use of hot packs than probably anything other modality that we do in the clinic. Okay, so causing a burn. So the other thing that that we get out of using heat is we're able to shift our oxygen hemoglobin dissociation curve, and so we have increased oxygen availability. So as what's demonstrated in the diagram right here is that as we increase the temperature, we're sliding over to the right a little bit, and so we're able to increase the availability of oxygen for tissues. Okay, so those are some of the metabolic effects that we're going to get. Neuromuscularly, we can reduce muscle spasm, and this is probably due to changing what's happening with our firing rates in the muscle spindles, and reduce firing of our alpha motor neurons. Okay, so we're slowing those things down, possibly affecting our the amount of muscle spasm. Okay, we're also able to increase pain thresholds. Okay, so another way to say that is to decrease the pain levels what someone is feeling. So increase the pain threshold, and then it's been reported increased nerve conduction velocities, but you can pull up different articles. Some will say increased, some will have decreased. We can demonstrate this when we do the EMG nerve conduction velocity section, but when you heat things up, things get faster, and that's something, as I do nerve conduction testing, I have to really monitor the lab temperature. You get a cold hand, and all of a sudden, it looks like the person has carpal tunnel as their values. Their nerve conduction velocity goes slow just because of a cold hand. So that can be a real gotcha. So therapeutically, why would be increasing nerve conduction? Don't really know. That's just a physiologic effect that we're going to get from it, that we're able to increase those conduction values if we heat someone up. All right, so one of the great uses of heat is being able to alter tissue extensibility, so we can stretch someone. And so when we do heat it up, we're able to maintain that length even after the force is applied, and it takes less force to get there, and we reduce the risk of injury by doing that, by tearing. Okay, so but what's important is that we're getting into a therapeutic range, and about a 5 degree C rise. So as I said a second ago, burning occurs at about 113, so we got to be pretty darn warm, okay, to be able to do that. And you have to have that temperature on in that 5 to 10 minutes. So at that temperature range, in order for those changes to take place. So we have to get someone good and hot, and for an appropriate length of time. Okay, so contraindications. Okay, so contraindications to heat is an acute injury. So something in the in that 2 to 3 day time frame. Someone who has impaired circulation, with problems with circulation, they're not going to be dissipating the heat as well, so you're liable to cause a burn. Same thing for sensation; they're not going to be able to feel the heat, so they'll the possibility of causing a burn. Okay, someone who also already has some sort of a inflammatory condition happening, and also impaired mentation, so someone who can't tell you that they're getting too hot for a burn, and of course over any tissue that we don't want to increase metabolism, so over a malignant tumor. So, and you can probably add in some things for yourself as you look at the list for contraindications. When you just talk in terms of tissues that we probably don't want to have increased metabolism for. So precautions listed there: pregnancy, someone who doesn't thermally regulate very well, over edema, cardiac issues, metal in the area because of the conduction, the high conduction of metal. Okay, open wounds and demyelinated nerves. So we have to be careful over nerve injuries or regenerating nerves. Okay, so when to use superficial heat? Okay, very good at decreasing general soreness and preparing folks to stretch. Typically, we use hot packs with toweling. You can use regular, bath sort of towels, and usually most clinics use a combination of toweling and then the hot pack covers, which you purchase when you buy your hot packs. And so those hot pack covers are generally considered to be twice the thickness than a regular bath towel. But it's up to you to kind of figure out and talk to your patients and figure out what's going to be the appropriate level of heat right there. So usually using 2 or so hot pack covers and maybe a single layer of toweling. I think that's kind of my typical formula, is using 2 hot packs, single layer of toweling. So in the layers of toweling scheme over here, that's given me 4 or 5 total layers. Okay, so kind of what's listed in your book is 6 to 8, but then you play around with that, adding another towel, another hot pack cover. You just got to kind of figure out what someone's tolerance is going to be. Typical treatment times are in the range of 20 minutes, and those hot packs are filled with a hydrophilic silicate. It's like if you'll see one of these broken open sometime, and anybody who's worked in a clinic has seen one. There, it's kind of nasty. It's this real fine, kind of snotty mud sort of stuff that's in those things, and they will swell and burst over time, and just give out being in that hot water over time. So, water tank usually sitting at about 160 degrees. And probably if you give it a range, maybe 170, but it's definitely something to monitor. And in military clinics as well as in hospitals, they're typically taking that temperature. And I know in a military clinic, it was being measured a couple times a day and listed in a log. So when you've got JACO coming around and inspecting your hot pack containers, it's something they'll look at. In your private practice clinics, no one ever looks. So, that the temperature, that could be anything. But it's just something to really monitor, because, again, this is where you're going to burn somebody. So recently at a clinic that I was working at, they had to replace the thermostat, the thing that controls the temperature in their tank. And when they replaced it, they could either get boiling or cold. And there was really no in between. They kept playing with it. And what they would do is they would let the water get up to boiling, and then they would turn it off for a while and use those hot packs, that were in there for a period of time. And then once they thought that was getting too cold, they would, kick it back on, let it boil again. Well, I mean, then you're all over the map with what you're given. So one, you have a high danger of burning someone. Especially since people get used to using the same number of covers and things when you put them on. So if I take one of those hot packs out of a boiling tank and put it on someone, there's going to be a lot more thermal energy there than if maybe 15, 20 minutes or an hour later I'm getting a fairly cool pack out and putting on someone. Probably not getting a whole lot of effect. So not the best idea. That's something that you need to be on top of. Take that tank out of service, get it fixed right away when you see a problem like that. Don't leave that thing in. All right, so supine versus prone, just something to consider that, when we're laying on top, this goes back to our rate sort of equation that, when you put that body weight on, not only are you squeezing water from the pack to accelerate it, but you're increasing the surface area. And you're increasing that because you're flattening that pack against the body and decreasing any air pockets. So you've increased the area, increased the rate of heat transfer. So just something to be careful of. All right, so we always want to make sure that we're taking clothing off. We're putting those hot packs because it's gonna leave you pretty wet, and as well as any jewelry in the area, because that metal's going to conduct through the conduction and get much hotter. We already talked about layers. Secure if needed, using some straps as you're depending on what body part and how you're doing it, and then give the patient some method to call or ring if discomfort occurs, and make sure that they know that if it's feeling too hot, they need to be given a shout out. Okay, because some people are just thinking, well, they're the doctor, they know what this is supposed to feel like. So you got to make sure you have them verbalize that if it's feeling too warm, to say something. All right, check in on your patients. Typical treatment time is about 20 minutes. Okay, so I'm not going to play this link here. You can follow the link for YouTube video. A couple of therapists, they're a little bit annoying, but it shows you a good demo, especially if you've never seen a treatment with paraffin, and done it. So follow that link there in the first slide. The nice thing about the paraffin baths, you can here's just something I grabbed off the web. $35, and you get a nice wax container, all the stuff, the wax, and so if it's something that's working for your patients, you can tell them to go down and find one of these at at Walmart or your local drugstore, things like that. So they're pretty common now. Okay, so I don't know what the commercial grade quality of these runs, probably hundreds. Difference probably being the quality of the temperature control, but little else. Okay, so not a whole lot of difference. So so nice thing to have for someone. Oops, that's working. Let me get back that slide. Okay, let's go back. There we go. Okay. So two common ways to apply the paraffin. One is to dip and wrap, and that's where you're going to dip your hand in, bring it out, let that paraffin solidify, and then dip it back in, and do that a few times so you get a bunch of layers of paraffin. Then you wrap it in a plastic bag, maybe put one of these gloves on like what you see right here, and you sit and absorb the heat. Okay, another way to do it is to dip, let the glove form. I'm assuming this is a hand. That's the most common place to do this, but is to dip, is to let the glove form, from the wax, and then re-immerse that whole hand in the tank and leave there. All right. So problems with that is that then you're gonna be standing there with your hand in a dependent posture, and so if this is a problem with edema, you may be causing more with that than the benefit. So it's for you to decide on how you work that in your clinic for applying your treatments. Just know that when we do this in lab, make sure you're going to be putting your wax back in, and you'll find that that's the one problem with the small tanks, is that they don't keep up very well. All right, so with the high use of all of us in there, we'll end up with some big unmelted chunks of wax. So just kind of realize that. Contraindications then to paraffin: open wounds, skin infections, acute inflammatory joint pathology. So along with all the rest of the things that we talked about for general contraindications for heat. Okay, so if you've never seen fluidotherapy, follow this link and watch that YouTube demonstration. You see these a lot in hand clinics. The nice thing is, looking at the picture over here, the therapist, they're not in there just playing handsy. They're able to, you're able to go in and do, joint mob, do stretching, do exercises. That's just it's a big tank that's has a circulating medium. So basically, it's blowing air in there. Typical use is some cellulose particles, and so there's also some sensory effect from doing this as well. So you have that. So temperature range, is what's listed there, 102 to 118. The nice thing is here, very active. You're able to exercise, you're able to joint mob, and utilize it that way. So nice piece of equipment to have, especially if you're doing lots of hands. So example of an infrared lamp. Again, not something you'll probably, like I said, I've never seen one of these in a clinic. So, but who knows? You might run into one. Okay, so that's just a type of radiant heat. Here have our infrared parameters. Again, it's superficial, so you get about a centimeter. You're going to position 50 to 75 centimeters away and perpendicular. If you get any angle to it, it's going to decrease the amount of energy. Okay, typically used in that 10 to 30 minute time frame, and it should just feel like a nice, comfortable warmth. Okay, so documentation. Think about what you're looking to do when you do a research project. You're looking for someone else to come along and read your method and be able to reproduce what you did. So you need to describe, what thermal modality you used, how you applied it, where you put it, how the patient was positioned, any precautions you took. Okay, billing. Don't even know why I put a billing thing in there. Most clinics are not doing any billing these days for superficial heat or cold, because most insurance companies, if they are paying for it, they're paying so little that it's not worth their time. So you'll just have to see what the practice is for your particular clinic. But I know the orthopedic practice I've been with for the last year, so they're not even, we only put that down as a billing amount.